Welcome, doctors. Let's talk about something that has become one of the most pressing challenges in modern healthcare: prior authorization. We all know it's meant to ensure patients get the right, medically necessary treatments. But in reality, it often feels like an obstacle course, delaying care, creating endless paperwork, and taking valuable time away from patients. Hospitals, in particular, are feeling this pressure. That's why today, we're going to explore practical strategies you can use to make prior authorization more efficient and less of a daily headache. First, let's be honest about the challenges. Prior authorization eats up time. Staff spend hours every day on phone calls, faxes, and portal logins. Even when requests are submitted correctly, small documentation errors can lead to denials. Add in the complexity of every payer having its own rules, and it's no surprise that approvals are delayed, and patient care is impacted. So how do we fix this? One of the most effective solutions is adopting electronic prior authorization, or EPA systems. Instead of the back and forth with faxes and phone calls, EPA integrates directly with your EHR. Requests can be submitted securely, with real-time updates, and the risk of human error drops significantly. It speeds up turnaround time and allows staff to focus more on patients, not paperwork. But technology alone isn't enough. Hospitals that succeed at PA management often streamline their workflow. Some build centralized PA teams that handle every request from start to finish. Others create step-by-step standard operating procedures so everyone knows exactly what to do. This level of organization prevents duplicate work and ensures nothing slips through the cracks. Another powerful tool is clinical decision support. Imagine your system automatically checking if a request matches payer criteria before you even hit submit. It can also suggest alternatives that may not require prior authorization at all, saving time and frustration for both your staff and your patients. Of course, none of this works without well-trained staff. Regular training on payer requirements, common denial reasons, and documentation standards goes a long way. When staff feel confident, they make fewer errors, and approvals come faster. And don't underestimate the power of automation. Automating routine reminders, pre-populating templates, and auto-attaching patient records from the EHR can shave off hours of repetitive work every week. That's time your team can redirect to complex cases that need clinical judgment. Now, let's talk about the bigger picture: relationships with payers. Hospitals that build strong communication channels with insurers often see approvals move faster. That might mean joining payer-led training sessions, giving feedback on policies, or establishing direct contacts to reduce back and forth. Collaboration here can translate directly into smoother patient care. Of course, measuring success is just as important as making changes. Track metrics like average turnaround time, denial rates, and even patient satisfaction. Data helps you identify bottlenecks, refine processes, and make the case for more resources where needed. And finally, for hospitals with especially high volumes, outsourcing prior authorization support is worth considering. Specialized PA teams stay on top of payer requirements, handle follow-ups, and free your internal staff to do what they do best: focus on patients. So, what's the takeaway? Prior authorization isn't going away. But it doesn't have to remain a roadblock. By adopting EPA systems, streamlining workflows, training your staff, leveraging automation, collaborating with payers. When needed outsourcing support, hospitals can transform prior authorization from a burden into a manageable process. The result? Less administrative stress, faster approvals, more satisfied staff, and most importantly, better care for your patients. Thanks for joining me today, doctors. If you found this helpful, don't forget to share it with your colleagues, because together, we can make the PA process work for us, and not against us.